Hello and welcome to our Foundation for Women's Cancer webinar, Shared Decision Making in Ovarian Cancer. This webinar is made possible through generous sponsorship support from AstraZeneca. We are joined this evening by Dr. Nita Lee, gynecologic oncologist at the University of Chicago, and Shirley Dow, four-time ovarian cancer survivor and patient advocate. It is now my pleasure to turn the floor over to Dr. Nita Lee to begin today's presentation.
Hi there, everybody. We're really excited to have our audience join us today. Shirley and I have known each other for many years, and we're really excited to be having sort of a discussion amongst ourselves, but one that we would like to get participation from our audience with about the role of decision-making in ovarian cancer. I'm going to go over a little bit of an outline, and we're going to do some introductions as well. So in terms of what we're going to cover tonight, we're going to go through some introductions of ourselves. We're going to focus on models for shared decision-making, a review, a focus on patient-centered care, and how best we can apply the idea of shared decision-making models to this continuum of care in ovarian cancer. And that really does go through aspects of care that may apply to new diagnosis, surveillance, and survivorship, facing recurrent disease, and making treatment decisions. These are conversations that I think Shirley and I have had during the course of her care as well. And I just we'll start with some introductions and go from there. My name is Nita Lee. I'm a GYN oncologist practicing at University of Chicago. I've been in practice since about 2007. And Shirley has been a longtime patient of mine, and I've learned a lot from her and her family as well. So I'm going to go ahead and have her introduce herself as well.
Good evening. I would like to introduce myself. My name is Shirley Dow, and I am an ovarian cancer survivor. I was diagnosed in April of '09 with stage 3C cancer. Within 5 days, I was having symptoms, and I was having major surgery that includes too many things to mention. Since then, I've had one more surgery, 4 separate sessions of chemo, which has actually amounted to 24 rounds of carboplatin and Taxol, and 4 different sessions of radiation, which has amounted to 57 treatments. All of this seems like a lot to handle, and I must admit, at times it is. As a patient, I feel we need direction. We don't always know the consequences of all that is offered to us. However, I have had the greatest opportunity to have a doctor who fortunately understands me. Between Dr. Lee, my caregiver, and myself, we've had to have so many decisions on what to do and how to do it when my cancer always rears its ugly head again. I really think that you must have an open mind to listen and hear all your options presented to you by your doctor. And then you have to think about your own opinion and anxieties and then come to a reasonable path to follow. What we need is honesty, and that is exactly what I get from Dr. Lee. I feel it's so important to form a bond between your doctor and yourself and your caregiver that you're all on the same page. Fortunately, I do, and I've been blessed with the best caregiver I could ever ask for. My husband has been at my side since the very beginning, but I feel that support, no matter who it is so very important. I'm also very lucky at this point to able to maintain a fairly active lifestyle. I'm fortunate to own a horse, and I still ride 5 days a week. I feel staying active is very important to me. It allows me to feel mentally and physically well no matter what stage of this journey I am in. Thank you.
Thank you so much, Shirley. That was a great introduction.
Okay.
I think it really balances all of the things that you've gone through, but also how you maintain your perspective. So thank you for introducing that.
Okay.
The next few slides, I'm going to kind of really go over what we know of as a model for shared decision-making. A lot of this somehow, all of those things that you mentioned about having sort of good communication, feeling like you have trust in your provider, those are all elements of how you set yourself up, and we set ourselves up to have good shared decision-making. But there is actually sort of a formal, study of this and a formal education process. I'm a fellowship director at our program, and a lot of times we actually are training our providers on how to model best communication and best shared decision making. So I wanted to kind of go through some of the models and some of the nuances, and I think Shirley and I will comment on how you felt, Shirley, that this really applied to you, or how we worked through things.
Mm-hmm. Okay.
The first slide is talking about just sort of like what is shared decision making, and you'll see I've addended some of these slides because I really don't think Shirley is represented by this woman with a cane. But ironically, despite all of these things being patient centered, there's a lot of like maybe more traditional ways of presenting this data that happens. So I apologize for that, but
that's okay.
Decision making is really a conversation that happens between a patient and their health professional to really reach a healthcare choice together. When you first think about sort of a paternalistic model, this is sort of a kind of like the stereotypical, like, I'm the doctor, do what I say, don't question me model. And that's really something that is not that appealing to patients or physicians. That's not the kind of relationship I want to have with my patients, nor do I think it's appropriate in so many settings, right? Then there's sort of this idea of sort of informed medical decisioning. Like, can we just give you all the information and then you decide amongst yourselves, like, what would you want to do? But I think, importantly, the shared decision-making really makes you realize that this is actually sort of a bidirectional, it's sort of a cyclical and bidirectional process where we're getting information and recommendations, we're balancing that with what our patients' values and preferences are, and we sort of proceed that way. I think it's really important, though, that we don't think of shared decision-making just in the sense of like patient-centered, therefore, as a physician, I should just give you a menu of all your options and then you decide. I think this tends to lead to a lot of confusion, and it doesn't really address the fact that we also want to kind of apply sort of the best scientific and best evidence-based care to kind of, make that plan. The menu option, I think, is also very distressing because, as you said, Shirley, like you want direction, but we want direction that takes into account how you feel about certain aspects of your care. So I think that's really important to remember.
Okay. I think in this process too, when talking to the doctor, I think, the patient has to understand the stage that you're actually really categorizing us in. And then,
right.
Does discuss the severity of that stage along with the treatments available to us. I feel that's very important because when you're diagnosed with cancer to begin with, I was the first one in the family to ever have it. And it literally blew us away. And you go online and you check things out, and that sometimes I think is worse than anything because there's too much information out there.
Right.
And
right. No.
it fills your head. And, to be able to talk to you in layman terms, it just makes it so much easier to, have that decision making go easier.
Yeah, no, I agree with you. I agree with you in terms of kind of setting up where you need to be and the kind of information you need to get. So this next slide, for the audience who now know Shirley from her introduction, I added the horse to hide the cane so that she could represent that. I know what her values and preferences are.
I do appreciate that. Okay.
So again, this is really sort of, a really collaborative process, and I think it's trying to figure out for during this webinar, like what do we expect from our physicians and providers? How can we best prepare as patients to be set ourselves up for decision making together? So I think that's important. The next question, or the next sort of slide, talks about person-centered or patient-centered care, and this is idea of putting patient-centered care really puts the concerns of people and their families at the center of the clinical decisions and recognizes from a provider's perspective that each patient brings her unique preferences, concerns, and expectations to any clinical encounter, and that we really need to strive to sort of incorporate those and integrate those into the decision. And obviously, we're going to go through some different phases of ovarian cancer, and that will kind of help us see through how sometimes the concerns and the priorities may change, and kind of keeping in line with all of those.
Okay.
From
Okay, and I was just going to add too, as far as the unique preferences and concerns and expectations and stuff, I really feel that, it's so important to have a caregiver there too, to share with the experiences.
I think that's a really good point.
At this point, my husband has 3 notebooks on me
Right.
And I know it's been a long time, but he does. He has actually 3 notebooks, and it's so important for him to be in on the concerns and stuff.
I agree. And I think that what you're talking about is also sort of being able to kind of have someone on your team that may be your spouse or your partner or a sister or a friend or even
Right.
like another caregiver or somebody who you can really go to and spend the time doing a lot of this evaluation about your own preferences.
Correct. Yes.
Um, Yeah. So shared decision making, we really know that we want to provide a patient-centered approach so that patients are fully informed of the treatment options and the trade-offs between risks and benefits, and then we incorporate values and preferences. And I think really having someone else as a sounding board, like you were mentioning about a caregiver, is really important. And some people have that within their own family. Sometimes we build that for people by some of our supportive services, or through different people have it through their church groups or different
Right.
other like colleagues. And so I think finding that right fit is a good thing.
Right.
When we
Even like
think about
in your mentoring programs too,
right,
that I
yeah,
feel
and I
that,
think
can even go there.
for sure, I think that there's just a lot of different ways that we can kind of get to that level of support. Part
Mhm.
of the reason we want to promote shared decision making is that we really do think it's the responsibility of the clinicians to, facilitate patients being able to make independent decisions. We want patients to be engaged and to really think through the risk-benefit trade-offs. Patients will probably be more satisfied is kind of some of the data, and that they may actually have better psychosocial, in some case even physical outcomes from this. And so I think it's important. I think, there's a lot of different agencies and organizations that are focusing on shared decision making really throughout the spectrum of decisions about cancer screening, decisions about medical issues, and now more and more decisions about cancer care. So we really want patients, when they engage in this process, to really, learn about their health, recognize that a decision has to be made, look at the pros and cons, really have the information and the tools that they feel that they need, and are ideally sort of prepared to talk with their provider and collaborate. So I think it's really important. This is a really interesting point in terms of like why is shared decision making important and when is it a good fit. I think it really does hit home when we're thinking about ovarian cancer, especially in the setting of recurrence or surveillance. In many situations, there is no right healthcare decision because choices and treatments come with pros and cons, and a lot of this is really dependent on the philosophy, the kind of the feeling of our patients, and when there's more than one reasonable choice, when there's no clear-cut option that has the best advantage, and that we really need to know how the benefits and harms can each be different for every person. I think the challenges to shared decision making, I think we're going to get into as we kind of talk about talking about the models and get into specifics of ovarian cancer, is that, and Shirley, I think you can speak to this, as for example, as a newly diagnosed patient, this is a really complex decision context where you have no prior experience to guide you, right? You're thrown into the world. There's a mismatch of information that you may have and what you need. There's a very steep difference of knowledge in like what I know at the time about this particular issue and my experiences versus yours. Sometimes, as much as we try, the face-to-face time where we're initially meeting people can sometimes feel brief when you're thinking about, how many decisions have to get made. And there's obviously the anxiety, fear, and such an emotional time for patients and caregivers. And so I think this presents sort of some people are paralyzed by this, so they don't ask a lot of questions, or some people go into a questioning mode where they don't necessarily give time to kind of think through what the provider is telling you, right? So there's both extremes, and I think, it's a really difficult time.
It is very much so. I can remember after my surgery, I held your hand. You came alongside my bed, and you were presenting to me, my different options and of everything. And I didn't think I was going to make it through the year. 'Cause like I said, I was the first one ever diagnosed with it, and my anxieties and fears just went over the roof. And in fact, my entire family was totally affected, and that's something I think that we have to be aware of. We even met with a psychologist at the beginning to understand the situation, and the psychologist told me that as a cancer patient you have to put yourself number one. at that point,
Mhm.
because you have to take care of yourself. And as a mother, that's really hard to do.
Yeah. No, of
Because
course.
you're always putting everybody else first. And I think, as the cancer patient, you kind of have to find that happy medium where yes, you're number one, but you still have to worry about the rest of your family and how they're handling it too. I think
Of
that's
course.
really,
That's such a good point.
it's a hard compromise, because
Mhm.
I think, like for my husband, as a man of the house, they always feel they have to fix everything, and they're the ones that you call on when something breaks down, and with this they can't do anything. They're helpless with it, and at that point sometimes they feel he handles it worse than I do. It's just more pressure on
Yeah,
him.
I think it's sort of like that balancing of like where the caregiver role comes, and I do agree that
Mhm.
like I think your example of like what has been the role is to really be that sounding board, note taker, cataloging things, and everybody will
Mhm.
find like their own skill set that
Mhm.
matches for that.
Right, right.
Um, some of the other barriers to shared decision making that come up are sort of this power imbalance and this, sort of like the more traditional models of medicine. Sometimes there's sort of the idea of limited health literacy. So it doesn't necessarily mean that somebody is not educated or educated. It's really just about like this can be just an area of that you know nothing about. Like when an electrician comes to my house and tells me why my switch is not working, like I have no idea what he's talking about. I just want the switch to work and go on and off, and I have no idea, and it's very difficult, right?
Right.
There's ideas of trust, fear, denial, normative beliefs of like, how you feel about the idea of a cancer diagnosis. So there's a lot of things that we're sort of like kind of in the environment when you're approaching sort of a decision-making time, which is difficult. What I want to do is switch to kind of some of these models, and I think they're really great. The common themes are bidirectional and open communication, and there's multiple models, and I've tried to pick some that are kind of most applicable. One of the models that I like is something called the SHARE model, which is the SHARE approach, essential steps of shared decision making. And some of the references are there from where it's coming from. But this approach here, and the way I put this slide in, is really looking at it from the point of view of a provider. And later in the slideshow, we'll kind of talk about like how can we flip the switch and sort of say, as a patient, how can you promote shared decision making if your provider is not necessarily feeling, you're not feeling like you're getting everything that you would potentially want. So from a provider perspective, we want to seek our patient's participation. We want to help our patient explore and compare treatment options. And sometimes those can vary. Sometimes, for example, in the primary setting, there are not as many options, and we are going to be a little bit more pushing towards standard of care and knowing what the scientific basis is of that. But sometimes when we're dealing with recurrent ovarian cancer, we do have a lot of choices that really balance quality of life and schedules and other life events. We want to assess our patients' values and preferences, and we want to reach a decision, and we want to evaluate our patient's decision with them.
And as far as I'm concerned with you, I always ask, when there is a decision to be made, do we do chemo? Do we do radiation? Do we do surgery? And what kind of chemo should we do? I always throw it back at you. Unfortunately, I put you on the spot. And I go, well, what would you do, Dr. Lee? And you always give me your answer. And I always go with your direction because you explain it so perfectly that this is how you feel, that my body can handle this. And I think that's, the trust that we develop between us, but over the years, you understand me so well with my anxieties. If you say, well, we need to do a test, let's go 3 or 4 months, I'm going to say 3 months, because, I mean, you just know it. But
Well,
that's the understanding.
I think that's a very, so what your point is about asking, like oftentimes patients will say, well, doctor, what would you do? And I think that actually is a very common cue for patients reaching out to say like, hey, like I really need help and guidance with this decision making.
Exactly.
maybe they're not getting as much as they want, or they need it in a different frame, right? And so, and I do think that when people ask me that question, I think I'm twofold. Like, there's one way where I'm like, honestly, what would I do if this was me, my mom, my sister? And then I also feel like I am informed by the fact of like what I know your preferences are about monitoring, or your preferences and comfort level. And so that will automatically guide you. And I think the more open you are with your provider about those things, they can take that into consideration. So I think that's good.
Right. Okay.
The Mayo Clinic on this slide has a really nice example that's called purposeful shared decision making, and really talking about how your method for shared decision making may differ between what the experience is. And so sometimes we're looking at like we're trying to answer the question like, which alternative is better, right? So we're really thinking about like harms and benefits and the outcomes of these interventions. You know, what do we want and what can we agree on? So this may be somebody who says like, I want to start chemotherapy, but I like don't want to start until after my daughter's wedding, and I want this and that. And those are like potentially negotiable things, because we want to take into consideration what's safe to do and what we want to do. There's problem solving when we know that there's a current situation that we may not be able to completely fix. These are situations that can sometimes be very emotionally laden. And then there's sort of like, kind of a deeper level of like really getting insight into sort of the nature of the problem. And sometimes that's what we're thinking about when we're talking about either, managing recurrent disease, thinking about potentially even times where we've had to shift gears from active chemotherapy to active supportive care. Those are all things that are different methods. This shared decision-making model kind of goes over a little bit more in terms of like sort of like how are we going to talk about our choices, how are we going to talk about our options, and how are we going to talk about our decisions. So like all of these things take into consideration this whole process. And so I don't want to belabor too much of this, but I do think that like if you think back to like decisions that we've made together, a lot of times this does fit into that, so where, a patient sort of, we know that there's a choice that we have to make, and we're really, we want to convey like, hey, these are the choices, these are the options that we have to do. And the decision talk is really exploring like what matters most to them, right? So like what are the things that matter most? And that's actually where a lot of this comes in. And I think a lot of patients can best prepare themselves. And Shirley, what you think too, like as to like, how do you prioritize what you value,
Right. I know as far as like that particular decision talk would be if I had a vacation planned in February. We were going down to Mardi Gras with my girlfriend, and you guys decided I needed radiation. Well, my theory was I can go to Mardi Gras the next year. Let's do the radiation now and get rid of it so that I can enjoy life after that. And I know other people, feel differently, and I think it's just a personal preference on how you can handle things.
Right. No, I agree. And there's not a right or wrong answer.
Right. Right.
The next slide really gets into kind of the heart of sort of like, models of like ovarian cancer and, what are the issues surrounding sort of a new diagnosis. So this is often the decision making about surgery, the different types of chemotherapy, decision making around clinical trials. The challenges that I put in here were sort of, again, the shock of a new diagnosis or a new recurrence, fear, learning the new language, meeting a new provider sometimes, limited time to make some, very life-changing decisions. And then things that are sort of facilitators that Shirley, you and I have talked about is sort of like really establishing like the goals of your treatment, right? So upfront primary surgery, our goal is to remove all of the cancer. Upfront primary chemotherapy is to effect cure. Open-ended questions that I can give, having a caregiver, potentially using some online resources and sort of techniques for sort of developing like a rapport with your, your new provider perhaps.
Mm-hmm.
And I think those are kinds of some things that we kind of think through.
Right. All the time.
Yeah. When we move on to kind of phases of like surveillance for ovarian cancer, the issues that come up are sort of this idea of like, are we going to check the CA-125? Are we going to go crazy by like, making you crazy every time we have to check it? Do we want to check it? There's actually data on both ways that maybe we shouldn't, maybe we should. And that also becomes a decision-making point. The role of imaging, like we've talked about, like when do I need a CT scan, how often, and then this underlying idea of sort of, managing your fears of recurrence and anxiety, the survivorship and surveillance phase when you're not on active treatment can have its own sort of anxiety, ironically, because of this like lack of security that you're on treatment, processing this idea of like a new normal, and then balancing that on the evidence that someone's telling you as a provider, like, yes, you're going to be fine for 3 to 4 months, but, balancing how you feel about that as well.
Right. It's very hard. I mean, I go in for my CA every 3 months. And I know that, some countries don't even take that into effect anymore, but for me, you understand it does work. I'm fortunate that way. And the fear of the reoccurrence is, it's just something I live with. I understand it's a cancer that's probably not going to be cured in my age. But I've also learned that when my numbers are good and my PET scans are good, I can relax for a few months and live a normal life. And then you just learn to live every day and be grateful you're here.
I think that's such an important perspective for all of us, quite honestly. So I think that really is, those types of perspective also teach me a lot too. So I think it's very helpful, and it's also very helpful in terms of sharing with others when they're going through this process, for sure.
Right.
The next phase is kind of like talking through, what's your decision-making process when you have a recurrence of an ovarian cancer? How are you choosing a therapy? Are we considering quality of life priorities? Are we considering clinical trials? How do we weigh all of these different things? And truthfully, part of it is that, this is, again, a challenging time. Patients may not feel at their best because of physical symptoms, those kinds of things. But I think that, we're also trying to kind of get at, recurrent ovarian cancer, maybe a time where we're thinking that this person may be living with cancer and off treatments, right? So it's definitely sort of a shift that happens. And so the shared decision-making goals, again, like you said, have to be really clear and have to be very well balanced. And I think you can speak to how many decisions you've had to kind of go through in this process.
I know, like one of the biggest things for me was losing my hair the first time. I think that was truly the hardest thing I went through. But after losing it 4 times, I teased my husband, if I have to do it again, I might come back a redhead. I mean, it's something that just you go through it and you live with it, and you go through the treatments, even though you feel really bad for a couple days or for a couple weeks or even a couple months. But when it turns around and you get a better report and you're still here, it's totally worth it. I mean, the hair and the neuropathy and the being nauseous and stuff, it's part of it, but it's also helping you to have better months later on.
Yeah, and I think that that's also really important, and also kind of just to kind of like put that in perspective. And surely, obviously, like I think that all of what you're saying is like very relevant, because I think it really depends on like how much those symptoms actually bother you and like detract from you of being able to like do your normal life, right? So if there was a circumstance where there was going to be some type of treatment that's really going to prevent you from horseback riding, right? I don't even know what that could be, but like, or somebody who potentially has neuropathy. Like I think I've had a person who was a piano player, and that really meant a lot to her, and neuropathy was just not something that was going to be acceptable because that was such a passion in her life, right? And so that's a priority that I think is really like we have to kind of pinpoint, and that may help me choose if there's 2 good choices, like which one's going to cause the least neuropathy, right? And this theoretical person may not care about travel as much and is willing to do weekly, and then I have somebody else who's like, I live very far, I only want to come once a month. And so those factors I think really do weigh in, and that's part of that really honing in on what your personal decision making will be,
Right.
So I think like when we're thinking about sort of our framework for expressing and understanding preferences, we want to reiterate sort of this idea of open communication, those kinds of things, really developing trust in order to promote this type of communication. We talked a little bit about sort of social support and balancing the role of your caregiver and your personal team. I think this is an area to kind of think through, because I think we also know that there can be times when your loved ones don't align with your personal values and with preferences, and so there can be some discord there, and that's sometimes, an important thing to kind of, either discuss with your provider or another caregiver, or, to try to reconcile that.
Mhm.
I think, a lot of what we also want to do is like look at like how can patients themselves really kind of express their values and preferences at the both individual level and at potentially like the advocate level, like being a research advocate, or driving what the research questions are about better options. Shirley, obviously, I didn't introduce you in the beginning of this, but Shirley's been one of our extraordinary peer mentors through our Woman to Woman program at University of Chicago, and really showed the role of that type of support can play as well. So I think there's a lot of ways that we can express and understand patient preferences. So I think that's really important as well.
I also just want to mention on the peer mentoring programs, I know, I got involved in it and I was a mentor. And I have to say, even just going through the training for the mentoring helped me understand myself as an individual, what we were going through. And Dr. Fay was able to give us reasons and a purpose on how to relax and control your anxieties. And it was just, to me, I think that was one of the most beneficial programs I've been through as far as the mentoring, because it not only taught me how to mentor somebody, but it helped me as a person to handle my own diagnosis.
Yeah, no, that's such a good point. I do think that there's so many different resources that are out there through the different organizations or through your local resources to really get at that idea of like, how do you kind of like grow and kind of, achieve sort of this growth as you're trying to understand how to better articulate your preferences and your values and your experience. And so I think that's very, very important for sure.
Definitely.
One of the things that we really wanted to spend the last two slides talking through is really like, how can patients make shared decision making happen, right? So this is really, it can be tough in some ways, because I do feel that there is there's a lot of things that happen in the interaction with your provider, which may be as short as 15 minutes, could be an hour, it could vary depending on what's happening, and really trying to figure out, and Shirley, this is where I want to ask you and think about what you and Glenn have done in terms of like, how do we promote that from the patient perspective, right? So I always say asking your provider, like, what are my options? Like, can you help talk me through this? Sort of what you were saying when patients ask, like, well, what would you do, right?
Right, right.
I think that's an important step. Taking time to really review and articulate your own priorities ahead of time or with your caregiver. So like not necessarily kind of waiting till that moment in the office to say, oh, okay, yeah, what am I going to say I value? But just kind of taking time to be really reflective of the things that have, that bring bring people joy and bring meaning to your life and that you want to prioritize,
Right,
that could be work, it could be,
Right. I know when we get ready to come in and see you, I know Glenn always, we make a list of my questions and my notes as far as like, what's happening with me and stuff. And because I know once we get into the office, you have a tendency to forget. And then sometimes you have a tendency not to remember. So he takes notes. And I think that, because you and I start talking about other things also,
right.
we start talking about families and stuff like that. And then I go, oh, wait a minute, Glenn has something written down. And I think that's so important, because then, you're on your way home and you go, gosh, I forgot to ask Dr. Lee. And so to me, having your caregiver with you during your appointments, if possible, is so important, because between the two of you, hopefully you're not going to forget everything.
Right. No, I think that's a really great tip for how to kind of make that shared decision-making process like a little bit more active on the part of the patient, right?
Exactly.
I think that's really important. Yeah. I think the third thing is sort of at least I came up, there's probably a ton more that we can come up with together, but I think really the third thing is sort of understanding that your experience as a patient and the priorities are really part of the information that like I need as a provider, that your providers need to kind of be able to best align what treatment choices are with what you
Mhm.
would want. Does that make sense? Because I think
Yes.
a lot of times people think information just means like, what can I tell you about the drug, or what can I tell you about the schedule, or like, and that actually is only part of the story. So
Mhm.
what are other things information-wise do you think are important that you'd like to hear about?
As far as like the treatments and stuff,
Yeah, or I guess in terms of like, what are things that you think about from asking me, or, like, or, what are those kinds of questions that we need to kind of think about asking our patients?
oh, asking the patients.
Or both
I
ways,
think,
either way. Putting you
yeah,
on the spot.
okay. I don't know. You're putting me on the spot here.
Yeah, it was
'Cause
a
yeah, you
spontaneous putting
really
you on the
are.
spot.
No, understanding as a patient, I think you understand me because we talk openly about things,
Mm-hmm.
and my fears and how I'm feeling and stuff, and then as far as the priorities for the part of the information, oh gosh, I don't know what the priorities would be because we always have this open feeling,
Mm-hmm.
as I
Well,
don't
I
really
think it's
know
the
how.
sort of idea. Yeah, no, I mean, I think from my perspective, I think it is just sort of realizing that the information takes different formats. Like some of the information is very, scientific of like what are the, some of the details of what, you would hear
Right.
about. But
Yes.
I think sometimes a lot of it can also be very much understanding your perspective in terms of concerns that you may have, concerns that your family may have. All of those elements may weigh in.
Mhm. Definitely.
I think,
I know.
you know,
I know. Like, go ahead.
no, go ahead. Go ahead. Finish.
No, I know. Like for my family, I mean, I wish basically they could come in with me sometimes to visit with you, so that they can understand what I go through with you,
Mhm.
but I have to give it to them secondhand, or Glenn does, okay? And I know you wouldn't want my whole family in there because they drive you crazy, but but it's just our experiences are always different. Every time we go in, I have to get in the car and text everybody, what's going on, what was said, what happened, how my results were and stuff. And I guess that's all I can say about that.
Yeah, no, I think that's an interesting point, because I do think what that also says is that when this is like the final model that I'm going to put up, but is one that really simplifies things, and just to say
Mm-hmm.
like there's a discussion phase, there's sort of a debate and deliberation phase, and then there's sort of a decision phase, essentially,
Mm-hmm.
right?
Mm-hmm.
And I think the information and the discussion and the debate, some of that happens in the office, some of that happens on your car ride home with Glenn, some of that happens when you
Right.
talk to your kids, so there's different elements of that I think need to be taken into consideration, and each person, is going to have different ways that they process that. So I think that's important in terms of like, so discuss, debate, decide. Those are kind of the three things that people really reiterate in terms of if you're going into a provider situation where you're meeting a new provider, or you're, just kind of think about that. Like, have we discussed all of the options? Have I debated these things internally, or maybe with the physician or with my partner? And then have we
Mm-hmm.
kind of come to a decision that seems like we can be at peace with this decision? And so I think
Correct.
it's really trying to, reflect on those different elements, I think,
Mm-hmm. Right.
So one of the things that this second to last slide here was kind of looking at that share approach and looking at decision making, and then trying to say, like, how can we change this to be like sort of a more active voice for our patients in terms of like how can we, provide them with steps to be able to do shared decision making. So I think to get your input into that, and then really to get if there's any audience questions or anything about this as well. So really sort of seeking your doctor or provider's participation, and that's kind of setting the stage by sort of saying, if there's a visit coming up, kind of setting the stage of saying like, oh, we really want to like, discuss this, or this is my top priority area that I want to talk about today. Help your provider understand you would like to explore and understand and compare treatment options. Step 3, I think I've changed it to sort of saying like assess ahead of time your own values and preferences and priorities for your care, and you can involve your caregiver team to help you, deliberate about that or to kind of discuss that. And then obviously reaching a decision together and then evaluating your decision. And then I always put in the fine print, though, like once your decision is made, it is the right decision. And what I often tell patients is do not spend a lot of time and energy second guessing your decision. There are always ways to change your mind and, other things that, new information that comes up. But I think really taking ownership that like you have made the best decision based on the information you have is often where we have to kind of let go of some of that,
Mhm.
I think one of the other things that comes up when we, in the literature looking at this kind of model and patient-centered model is do patients want care to be delivered in this way, or do you think it puts too much on the onus of the patient and not enough just direction from your physician? That's, I think, a really important question because some people feel like they don't want to make these decisions and they want to be able to trust their physician to make more aspects of this decision. So I think that balance, it would be interesting to think about what you think in that perspective.
I think personally it's a personal opinion. Okay.
Mm-hmm.
Each person is different. Somebody
Mm-hmm.
who, gets the diagnosis of cancer, they want their doctor to just take care of it and get rid of it. And,
Mm-hmm.
they'll just listen to whatever, whatever they say, and that's it. Okay. And other people, they want to be part of it. They want to understand it, and they want to survive it. Okay.
Mm-hmm.
And,
Mm-hmm.
knowing with ovarian cancer that, it's a hard one to beat. So, I mean, I think you have to, be part of all of the decision making, because then you're not just saying, if something doesn't work out, you can't sit there and say, well, my doctor it didn't work.
Mm-hmm.
I think between the patient and the doctor, you come to a decision, you go through the treatment, and if that treatment didn't work, well then okay, we move on to a different treatment. But there's no blame either way. It's something that you tried and it just didn't work.
Mm-hmm. Mm-hmm. Yeah, no, I think it's important in terms of like the relationship and in how we kind of move forward with that. And I do think ovarian cancer in particular, and any particular cancer that is potentially facing the situation of potentially starting off at an advanced stage or kind of having these risks of coming and going on treatment can really heighten the emotions of that. So I think it's important to kind of be able to kind of take that perspective and to know that this is what we want, we think of as a really good model for how to approach your care and how to kind of like the marathon approach, right? Like we want this to be a marathon, like we want to kind of balance out all of the aspects that we're doing. So
and sometimes, I know one time we tried a different chemo on me, and I only had one treatment, and they literally put a mask on me, sent me out of the hospital, and said, you have to get out of here right away because my blood just didn't react to it good. So I mean, it was something that we tried, but it didn't work.
Right.
And so then we went back to the carboplatin and Taxol, and I don't know if maybe you were trying to save my hair that time. I don't know, but I mean, it's something that, to me, it's a hit or miss. There's no definite step to follow on this cancer. And I think, the more the patient understands what the ramifications are in each treatment and each different treatment, the better off they are. Because then they're in that decision making. They're saying, okay, let's do this. Let's go this route. We'll try this. If this doesn't work, maybe you've got something else up your sleeve.
No, I agree with you. I mean, I think it really does get at the idea of, for ovarian cancer, we really feel like sort of building your team and kind of building your team approach with your provider, potentially involving like other, providers or other support people, whether they're your family or other entities, is really important. And I think that there are a lot of resources that are out there, again, like I said, either online or at your local cancer center or your local hospital, or even talking to your doctor about those kinds of things are really a way of kind of opening that conversation. So I think that it's a really important thing to be able to kind of articulate.
Right. Well, and I'll be watching the news, and they'll come up with something new, where they're
Mhm.
trying it on like breast cancer, and I look at my husband and I go, maybe that's going to work for ovarian someday.
Yeah. Yeah.
You don't know.
For
You
sure.
have to
Yeah.
stay around, and maybe they're going to fight it.
Exactly. Exactly.
You just never know.
So I know. So I think that, we're going to probably start towards our ending. I just wanted to say, I wanted to take some time to take any questions or any discussions. There's definitely other topics that we can talk through, and I don't want to put Shirley too much on the spot, but I wanted to kind of say thank you from both of us. I have a small picture here of Shirley and Glenn for everybody to see, as well as another time where we put Shirley on the spot, and she did an excellent job presenting at one of our conferences, Patients as Teachers, Enhancing Communication. And I just wanted to kind of say thank you to Shirley for really being so open and honest with your experience and really putting it out there in terms of sharing. Because I think there's a lot of people who can benefit. So
thank you for having me. And can I just say one thing?
Sure.
This is to all the people that are listening, okay? There was a comment on Facebook just a couple days ago, and I wrote it down because I really felt it was just so important. It says, if you're having a rough day, place your hand on your heart and feel it. That's called purpose. You are alive for a reason, and don't give up. And that's what I would want everybody to know.
That was a beautiful sentiment. I really appreciate that, for sure.
You can't give up. You got to stick with it.
Yeah.
No matter how hard it is, you got to stick with it because every day is a blessing.
Yeah, and I think that's a really important thing in terms of that the purpose that you have with your, a lot of women do find a lot of purpose through their cancer journey. And,
right.
And sometimes it is a point where we have to be reflective on patients who, find it at different times in their lives and find it in different ways. And so I think just being reflective of how do we find all of our own purpose, whether it's, through your family or friends or other work or, whatever way it is very important. So I appreciate you saying that. So,
okay. Thank you.
We have about 10 minutes left, so I'm not sure if we have any other questions or we want to kind of continue our conversation a little bit. We'll be able to kind of spend some time thinking through this, and we'd love to hear from you.
Great. Thank you, Dr. Lee and Shirley here. We do have time for some questions. Please, any audience member that would like to ask a question, make sure that you're using the Q&A tab on your interface. Go ahead and type your question in the box and hit the submit button to register. And go ahead and read your question aloud.
I think that, one of the important things to remember too, as you're kind of going through the ovarian cancer sort of process and journey is also that it may not be just one particular provider that does, is able to provide you with all of this type of help with decision making. Sometimes it is your primary GYN oncologist, and obviously we really do feel strongly that for ovarian cancer we should have a GYN oncologist that's involved with your care. But some of my patients, for example, do a lot of this decision making with their medical oncologist, and then come to me with specific questions, or some people who are particularly close to their primary care physician. That may be the space where a lot of this discussion happens. So I think it's making sure that you're sort of flexible too about where that process takes place too.
I personally see you more than I see anybody. I do.
That's true. That often happens for a lot of our patients. So I think it's a natural connection to kind of say that we're going to be the team to kind of talk through
exactly.
things.
I know. I was just in there seeing you last week, and you asked me if I had seen my family doctor, And I said,
Yeah.
no.
I think that really varies. There's some people who like had like just a much, like a different relationships or different,
Right,
so
right.
I think it's just, finding
I
that
mean,
right fit. And I also think that you don't always find the same fit with the same person, right? So I think it's important to
exactly.
kind of think through,
I mean, I have to say, I saw my family doctor when I was shopping, and we ran into each other, and she gets all the reports,
Right.
at the UFC sends all of my reports and everything, and so we had a discussion in the middle of Carson's. This was before
Oh
Carson's
my goodness.
closed. Yeah, we were both shopping, and she goes, "Oh, I'm so glad to see you and stuff." But I mean, if I have the flu or the cold or whatever, I
Sure.
would go in and see her and stuff. But for the most part, you're the main person, you know.
And I think that does happen, I think, and that's kind of how we, really appreciate that relationship with our patients because we feel like we can get to know people at a different level.
Right, right.
But I think it's, I think that the struggle is sometimes you do feel like there's patients who maybe don't find that type of connection with their
Mhm.
primary, so it's just, you just have to kind of like try things out in a way to,
Right,
make sure
right.
there's a good that happens. So.
Yes, yeah. No, it's definitely, but it is funny because we were just talking about that last week.
That's too funny. Oh, I clicked onto
Yeah.
this again. Well, we'll leave with the domains that we want people to really kind of think through, and again,
Okay.
sort of use the process of thinking through how, whether they're big decisions or small decisions, like how can we help support, making sure again that, the medical care and the treatment decisions are sort of just part of the story. The whole story is the rest of your life in terms of what you're doing and the time that you can spend away from the office. But I think
Exactly.
we want to be, a part of that. So.
And I think, as far as being a part of it and everything, I can't stress how important it is to have somebody to count on as far as a caregiver. It's helps me out emotionally, mentally,
Mhm.
physically.
Mhm.
It's a great thing to have, and I feel bad because some people don't have that, and I think that's
Mhm.
where possibly getting in contact with a mentor might
Mhm.
be beneficial because at least I know the person that I was mentoring, we had open discussions, and I mean we would talk for an hour at a time sometimes because she could tell me things that she couldn't tell her husband, and
Mhm.
then we would laugh about it, and I know she felt better about that because she could confide in somebody where I can confide into my husband, but obviously she couldn't with hers.
Mhm.
And I understood her problems, and it just helps you get through things.
Sure. No, for
And
sure.
and as a mentor, it helps me get through things realizing, okay, there's somebody else going through something too.
Right.
And
No, I think it's about forming that sort of community, and I think that's what we want to kind of emphasize too, for sure. That there are, that
exactly.
there are a lot of resources that are out there, both at like the local and national level, to kind of really
Mhm.
help people find,
Right.
find that purpose and find that perspective for them.
And
So.
I've done cancer walks, and I've done those, what are they called, bikeathons or cyclothons,
Yes.
whatever,
Yes.
what are
Yeah.
they called,
Yeah.
bikeathons? Okay. And I
Yeah.
have to
Yeah.
say, I was very hesitant to go to the bikeathon at the first one, because I know a lot of times when you're diagnosed with the ovarian, everybody looks at it that it's a terrible cancer, and you're not going to make it, and it's proof that you will make it when you go
Mhm.
into a
No. Right.
building and you see 100 other people there that are supporting cancer people, and you see other women that have lost their hair but they're still there, they're riding their bikes, they're going through life, and I think that's just so beneficial, and it builds you up internally that, hey, you know what, if they can fight it, you can fight it.
Yeah, no, I think that's a great idea in terms of like how to kind of like, generate forward motion, right? And kind of,
Yes, yes, you have to
keep,
continue on.
yeah.
Um, it's the walks and like I said, the bikeathon. That was hard work, by the way. That
Yes,
bikeathon.
that's for sure. Well, I think
but we got
like
through it.
Yeah, we did get through it for sure.
Yeah.
We get through it every year. So.
Right.
So I think, it sounds like we've had a good discussion, and I hope people have gotten a lot out of it in terms of like how to potentially take home tips on like what kinds of things to think through, what are the aspects, and how you can take this to kind of really be reflective of your own values and preferences, and how you can bring this to your physician or provider. And obviously we'll be, working with the organization to kind of help us, with Foundation to kind of, promote this type of resource for our patients. So I wanted to kind of thank everybody again for being here tonight.
Thank you too.
Great. I don't see any content questions here in our Q&A section. And we're right up against it. So thank you all so much. That will be all the time that we do have for today. So on behalf of FWC, I would like to thank all of our attendees for joining us today and for your participation. I would also like to give a big thanks to Dr. Lee and, of course, Shirley for their great presentation and talk tonight. Before you do shut down tonight, I do ask that you take a moment to fill out a brief survey that you should see appear on your screen in just a moment. We appreciate your feedback as it does help us improve our future webinars. Again, thank you so much for joining us today. We all hope you have a great rest of your day.